completely crazy. How are you?
It's pretty good.
Yay! I'm good. So I am just going to. Anyway, my name is Esther Yang, everybody. Welcome to the Esther Yang live show. Sorry about the inconvenience with the Instagram, but we figured it out, so meet Dr. Lee, the most fantastic one. Anyway, I'm so glad you're here. I'm so glad. I know this is our literally fourth part, and we miss Jenny, and obviously we miss Anthony. He has his gala tomorrow, and I want to be successful. You're going to be there tomorrow, right? For the gala?
Tomorrow, unfortunately.
I know. You're going to be really, really busy. So tell me about this Delta. I know you want to read your disclaimer, so feel free. Go ahead.
So just before we get started, I just want to sort of mention that the COVID-19 pandemic is ongoing and that new information continues to be discovered. And so what we're going to talk about today is only current as of today. And that everything we talk about is really intended for educational purposes only and is not a replacement for medical advice. If anyone watching this has questions about their health, they should please contact their healthcare provider.
Yeah, I think that's really a good thing, right? I mean, I don't understand why people will not contact their, them doctors and then will get the second opinion. But, I was born in Jakarta, so Jakarta is completely insane with the Delta variant. I think the last time I checked, it was 69% in New York City, the Delta variant. So what do you know about the Delta variant and why is it so dangerous?
So the Delta variant, which was first discovered in December of 2020 and first came to the US in March 2021, it's really, really contagious. So sometimes you might hear people refer to it as the most fittest version of the virus. And so when scientists talk about fitness of virus, we mean sort of ability to be contagious and to be transmitted. And so right now it seems like this strain of the virus is around 50% more contagious than the Alpha variant, which was already 50% more contagious than the wild type, the original virus. And the leading sort of theory on this is that it produces really, really high viral loads. So for every sort of drop, a respiratory droplet that somebody would produce, it's sort of teeming with many, many copies of the virus.
So, I mean, besides masking, like people still have issue with masking. Besides masking, what other suggestions? Obviously hand wash. What other suggestion you can suggest so that we can protect ourselves and protect our family?
Well, so the main thing that people can be doing to protect themselves is to get vaccinated. So one of the reasons why Delta is so dangerous right now is that it's coming at this sort of unique time. It's coming at a time when all of the things that have been protecting unvaccinated people have been relaxed. So, mask mandates, have gone away in almost every setting in New York City besides, essentially doctors' offices and the subway. All the social distancing guidelines, all of those restrictions on gathering, those have all gone away. All of those things used to protect everybody, regardless of whether or not they were vaccinated. Now, the only thing that can really protect people is getting vaccinated. All three of the vaccines that are currently approved in the United States protect against the Delta variant. We have good studies that have come out of the United Kingdom related to sort of real world, like how are these vaccines protecting against the Delta variant? The main vaccines that are being used in the UK are the Pfizer vaccine and then 2 doses of an AstraZeneca vaccine. The AstraZeneca vaccine is very similar to the Johnson & Johnson vaccine. But there have been 2 sort of things that are kind of the studies that are worth highlighting. One is that the vaccines work against the Delta variant at fully vaccinated status, and that they really don't work as well at partially vaccinated status. So it used to be that we thought that if you were in between the 2 doses of a vaccine, you were reasonably well protected, maybe not, obviously not 100% protected. That is really not the case with the Delta variant. People that are only partially vaccinated are not that protected.
Right. I mean, I heard that, including my brother. My brother got Sinovac in Jakarta. He actually got COVID. And so I've heard people, even though you are not 100% foolproof anything else, but I think like 99% of the death, what I read was 99% of the death are unvaccinated people.
Correct.
And the people, even though you're vaccinated, you can still get Delta variant.
Yeah, yes. So the New York City, I mean, many municipalities have been releasing data about this in the last couple of weeks, but New York City released theirs last week, and they said basically since January 1st, 2021 until now, 98% of all infections, 98% of all hospitalizations, and 98%, I think that's what they released, have been in people that are unvaccinated. So one of the ways, because Delta is so contagious, and statistically speaking, no vaccine is 100%. There will be people who have been vaccinated who do get infected. The vast majority of those people who are vaccinated and who get infected will not need to be hospitalized, will not develop severe illness, will not die. They will have a mild course. One of the things that we don't know yet is whether or not someone who is vaccinated and gets infected, who has a mild symptoms, whether or not they are themselves contagious. We just don't know. We don't know that yet.
So you don't even know that the people, they could be a carrier?
They could be the people that could be carriers. There's the CDC released a report the other week about an outbreak that happened in a gymnastics facility in Minnesota. And one of the things that it couldn't, that it was sort of seeking to answer was how many people did continue to get infected, and really the people that were driving the infections in that report were people that were unvaccinated.
I mean, I'm still wondering. I mean, we talk like from the beginning, like before there were no vaccines, lines were going on, and I don't understand why do you think people don't get vaccinated?
I think there's a lot of reasons. I think one, people are really worried about how fast we got these vaccines, and it's one thing I hear a lot, that this was developed really fast, and so it can't be trustworthy because they must have cut corners in order to get us these vaccines so quickly. That's simply not true. All the safety parameters have been followed.
And it's approved. I'm not mistaken. I mean, this vaccine, like I've had my vaccine is the Pfizer, but these vaccines, Moderna, Pfizer, Johnson & Johnson, are FDA approved, right?
They have emergency use authorizations.
Right.
Pfizer has applied for full approval, and Joe Biden and his administration indicated this week that they probably expect that these will be approved. So one of the main reasons why they were able to be developed so quickly is that scientists have been working on vaccines against the coronavirus, going back, over 10 years. The SARS outbreak in 2003, the MERS outbreak, I think was in 2012. Scientists have been working on vaccines against coronavirus. So we had this running start in order to develop these vaccines against SARS-CoV-2, the virus that causes COVID-19. And then I think the other thing is that, you have to trust the government in order to, and all the institutions in order to sort of say, well, okay, I'm going to go ahead and believe that this is safe and effective and that what they're saying is true. And if you're from a community that has been disenfranchised or exploited or experimented on by the US federal government historically, then you might have some really legitimate hesitation. And then there are other, and so, okay, if you're not going to believe the federal government, okay, well then you got to believe the medical establishment and the pharmaceutical industry. And then there's a whole group of people who have, lived experience of being exploited and mistreated by the healthcare community. And we've got, this is an opportunity to try and rebuild that trust. And so I really encourage everyone to find a trusted healthcare provider in their community that they can answer, that they can get their questions answered. And every question that anyone has about the vaccine is totally legitimate and deserves to be answered. I would just hope that people ask their questions and get them answered.
I mean, I can talk about me. When I get the Pfizer, my first shot, I mean, all I had was fever, and that was it. And I was very fatigued. So that was the first time. But the second one was much more exhaustion. Like, I feel like really tired. I literally slept like 14 hours. I just was really, really tired. And I had fever for like 2 days. But then that's it.
Yeah.
I don't even feel the, well, You know, people say, don't you feel sore in your arm? I think maybe because I'm a black belt and I get punched so much, you know, then I said like, well, you know, it's like,
Yeah, there's what's a shot in the arm. Yeah.
yeah, it's like, I don't, but a lot of people like couldn't lift up their arm, but to me, it's no big deal because I do fight class all the time, but that's really it. So I don't, I mean, I'm grateful I'm vaccinated so I can go to visit my niece and travel, but what is it? I still like one of my aunt is not vaccinated. So I just feel like I don't know why that I mean none of us could understood. And the way her argument was, well, all of you are vaccinated, so I don't have to be vaccinated.
I mean, I think
Sorry.
we may eventually get to a place where that's true, but we are so far, so yes, if we were achieving herd immunity,
right,
which is where there's enough vaccinated people basically to sort of surround each unvaccinated person, so to speak, then that would be the case, but we're so far from herd immunity. So
I mean, I know you shared this so many times. I mean, can you just really tell us? I mean, I share about my Pfizer. I mean, what is really the side effects of the Pfizer, the Moderna, and the Johnson and Johnson?
So there are the mRNA vaccines, the Pfizer and the Moderna vaccine, cause more. They have more sort of systemic side effects around the time of injection. So almost everybody with all the vaccines will get some sort of sore arm. A lot of people will get a little bit of redness or swelling at the injection site. It goes away on its own in a day or two. And mRNA vaccines can cause things like fever, sort of whole body muscle aches, tiredness. Some people have trouble sleeping. Some people, like sleep a lot. Sort of like a flu-like reaction. Again, it usually only lasts 1 or 2 days and will go away on its own. The Johnson & Johnson vaccine has less of those systemic effects, although they're still theoretically possible that they happen at a much lower frequency. And then there are also not legitimate, those are all legitimate, but there are sort of other like side effects that, for all three of these vaccines, that the risk of it's really low, but it's certainly worth talking about. I mean, the Johnson & Johnson vaccine now has warnings about the TTS, the kind of blood clots that have happened mostly in women under the age of 50, but it has happened in some men. And it's just important for people to be aware of what those symptoms are so that they can seek the appropriate care if that happens. Right. And same with something called Guillain-Barré syndrome, which is
in New York, no appointment needed anymore. You can literally go anywhere. And I just want to encourage everybody, obviously, like what you encourage, please get a vaccine. And if you are not comfortable to get a vaccine, like from the urgent care or anywhere else, any primary care physician can give you a vaccine, correct?
Yes, it might, they might only have one vaccine. The other thing we have in New York is the ability to choose. You can seek out one or the other. And so your provider might only have one kind, but they can definitely help you make an appointment. And so, the thing that I'm really encouraging people to do now is obviously we want everyone to get vaccinated, but if you don't feel comfortable getting vaccinated right now, please seek out information because I really want people to get all of their questions answered. And I don't want us to feel like we are, we're sort of like, we're so high and mighty and everyone must get the vaccine. And, I want everyone to get the vaccine because I care and I want everyone to feel protected. COVID-19 has become a vaccine preventable disease. And so I really want, I want to avoid unnecessary death and suffering. And really the best way to do that is with vaccination.
Yeah. And it was very frightening because I was home locked down for 6 months, literally. I did not go out. I mean, you're like one of my heroes, right? Because you have to go out there. So I don't want to go back into that life, like where I have to do triple mask. Like now it's such a luxury feeling for me to go out without a mask. But now with Delta variant, I know the mayor is asking for people to mask again. And so I don't want to have to go back. So, but I'm still, for myself, I'm confused. How do you know that you have Delta variant? Do the doctors take blood tests and see?
Yeah, so the city right now is sequencing about 10% of all positive samples to see what their genetic sequence is. And so So that might tell us, is it Delta? Is it Beta? The other one that's circulating a lot, or a little bit less of the city, is Iota. The WHO has created a name designation for each of the strains.
I see. That's how we know that we are 69%.
Yeah. It would be better if we were genetically sequencing more samples. We would have a more clear idea of what's going on in the city. And so we could always improve in that way.
I see. So, and again, it's where, even if you're vaccinated, it's 100% proof, right?
Right. There's no vaccine that works 100% of the time. They don't create barriers to prevent viruses from entering our bodies. What they do is they teach your body to recognize the virus so that it can then fight it off very, very quickly and prevent you from getting sick.
And so when do you think, is there another vaccines coming up that you hear about, or have you heard of anything new?
The vaccine that a lot of people are waiting for more data on is the Novavax vaccine, which uses a totally different platform than the Pfizer, Johnson & Johnson, and Moderna vaccines.
That's coming out.
Yeah, so we expect they should be reporting data really, really very, very soon. And then the other things that are sort of coming down the pipeline that are kind of exciting and encouraging, there are a couple of groups who are working on and this has been going on since before the pandemic, but it's obviously been accelerated now, that are working on a universal coronavirus vaccine. So this would be a single vaccine that would protect you against MERS, SARS, the virus that causes COVID, and then a couple of the common cold coronaviruses. And so, which would obviously be amazing. And so those tests are being done. That's still in animal studies, but it's really encouraging.
Yeah. And when will that be?
A couple of years, probably. That one might be like a third or fourth generation vaccine.
So when you have do you think that every year, because I got this vaccine this year, so next year, is it a yearly thing that we need to get, like a flu shot?
Potentially. I mean, right now the FDA and the CDC, they put out a joint statement a couple of weeks ago saying that we are going to continue to follow the science. There's no indication that people need booster shots right now. For me, what I would really love everyone to focus on is, instead of getting Americans the third shot, we need to get the rest of the world their first and their second shots.
Yeah. I know a lot of people in Asia who had Sinovac, they actually get Pfizer on top of it. Now,
and that's recommended in this country too. Let's say you managed to come to the U.S. from a country from somewhere else, and you got Sinovac or Sputnik 5, some of the other vaccines that are not approved in this country and also not approved by the WHO. The protocol here is then to sort of say, we'll treat you just like someone who's totally unvaccinated, and you should get the full series of.
Yeah. Because my family in Asia, in Jakarta, Singapore, they don't have Pfizer or Moderna, or even Johnson & Johnson. They only have Sinovac.
Yeah.
And so when they come here, they Pfizer, and I was wondering if that's okay, if that's dangerous.
Yeah. No, that's recommended.
Okay, well that's good. And when do you think that? I know that you and Dr. Jenny and Anthony talk about younger than 12, because right now it's up to 12, right? So what about younger? And that's the issue with de Blasio, with Mass Elementary School.
Yeah, it's really confusing for families with kids under 12. You've got parents who are vaccinated and kids who aren't, and how do you approach school, or how do you approach daily life with a member of your family that's still vulnerable? Everyone is doing studies right now on kids younger than 12, and it's one of the things that probably by the end of the summer, if not sooner, there will be some rulings on approvals for kids younger than 12.
Okay. So my last question is mostly because my family wants to ask the question and they can't be on live, so I'll ask the questions for them. How long after Sinovac should they take Pfizer?
I think it probably. I don't know off the top of my head. I can look it up and get back to you.
Yeah, that would be great.
Yeah, but there's a CDC protocol for this.
What is the CDC protocol? Do you know?
I don't know. I don't know the days off. Like sort of the time spans off the top of my head. But there is a CDC protocol for vaccinating here in the U.S. someone who has received a non-U.S. approved vaccine.
Okay, I mean
the Sinovac vaccine. It's a inactivated virus vaccine, which is a really sort of tried and true vaccine platform. It just so happens that it didn't work as well as we had hoped.
No, yeah,
it would be wonderful if it did, but it didn't.
No, I know, because my brother got Sinovac and he has COVID. After that, he's fine now, but still, it was that was that part. And then my other family who got Sinovac decided to when they came to visit, they decided to take the Pfizer one. Because so this is why I was surprised. I said, "Wow, you got 2 of the vaccinations," because they said, "Well, and Esther didn't work."
Yeah,
so I wanted to be on the safe side. But I
like for example, like let's say you only got 1 dose. You got your first dose of the Pfizer, and for whatever reason you weren't able to get your second dose, and it's now after 6 weeks since your first dose. You could go, and under CDC protocol, you could go and get a Johnson & Johnson vaccine.
I see. So within that 6 weeks, so
after within the 6 weeks, you should get the Pfizer. But if it's after 6 weeks, it's sort of between you and your healthcare provider to figure it out. But there is a CDC protocol that allows for vaccination, say with Johnson & Johnson.
Yeah. So just to recap, as we're ending, so we have 3 of the vaccine: the Pfizer, the Moderna, and the Johnson & Johnson. If you don't have your vaccine, please get vaccinated. Yes. And then even if you are fully vaccinated, it's not 100% foolproof that you will not get Delta variant.
But all of the vaccines offer strong protection against the Delta variant. And against the things that really matter, which is death and hospitalization, right? Like as a physician, that's the stuff and someone who cares about public health, that's what really matters to me. It's preventing death and severe disease requiring hospitalization. And all of the vaccines do that against the Delta variant.
Right. And then it's like, because right now they said 99% of the death is unvaccinated.
Correct.
Right. So I prefer everybody get vaccinated, like you. I prefer everybody get vaccinated because why not? Because it's available.
Well, and because if everyone doesn't get vaccinated, then we need to be doing more non-pharmacological interventions like social distancing and gathering restrictions and all of that. And if we're not going to do that stuff, we need to be vaccinated.
Yeah, and I'm very disappointed that people that are not vaccinated also gathered, and like not. I don't think I feel for myself they're being selfish. They're not being mindful to the rest of the world.
And you see these videos of people who are doing exactly that, who are unvaccinated, who are gathering, who then got COVID, and then they're calling all of their friends from their hospital beds saying, "Oh my God, it's real, please get vaccinated," or whatever. And I just want to, if we can avoid people having that realization after the fact, it's really about, getting vaccinated is the best thing people can be doing to protect themselves, their friends, families, and loved ones.
There was a story in the paper where this doctor, where these patients had COVID and they were begging the doctor to give the vaccine, and the doctor said, "It's too late now," because they thought it was a hoax. And that's I don't get it. How could it be a hoax when New York had so many deaths per day? Remember that time?
I mean, that's the other thing. I mean, vaccines prevent disease; they don't treat disease. And it would be wonderful if all of a sudden the FDA approves some new treatment for COVID-19 for people that get sick, so that they can recover faster. But we've been really successful with vaccines. We've unfortunately been less successful with therapeutics.
Yeah, well, definitely. I'm grateful. Like you've always like this. So brilliant. I learned so much from you every single time that you're on. So thank you so much. Have a great night.
It's wonderful to be with you.
Everybody, see you.